Okay, thank you very much for that generous introduction, Lynn, and good morning to all the people of Ballarat region. I'm going to talk about insomnia today because during this period of COVID virus, there's probably a lot of stress on people, and insomnia is one of the byproducts of stressful times. Whenever we go through stressful times, we might find it difficult to sleep. So that's what insomnia is. It's basically a problem of getting to sleep and staying asleep. And to maintain our health, we need probably three things really: good sleep, good exercise, and good eating. And the fourth one would be a good psychological state of mind. So I'm going to work through some techniques that might help you if you're having troubles getting to sleep or staying asleep. So insomnia is the problem of trouble getting to sleep and trouble staying asleep, or a mixture of both. Some people have a long time to get to sleep. Some people wake up many times during the night time. They're all signs of insomnia. There are many different types of sleep disorders, but of all the different sleep disorders, insomnia is by far the most common. And during normal times, it's estimated that about 10% of the population might be suffering from insomnia at any one time. Some of us can suffer from insomnia as an acute thing that only lasts for a few weeks and it goes away after we go through a period of stress or concern or worry. Or it can become a chronic problem that lasts for many, many years, and in many cases it can be treated quite well with psychological and behavioural techniques without the need for sedative medication. In my experience of many years at hospital insomnia and sleep clinics, I would say that only about 1 or 2 people in 50 really require medication. The rest of the people can be treated quite adequately with behavioural techniques. So if I was only allowed to give you one technique, it'd be this first technique, which is, if I can get the slides to move. For some reason. Yep, here we go. Okay. If I was only allowed to give you one piece of advice about how to improve your sleep, it would be to get you to have a regular sleep-wake pattern. This is very important because we have one particular period of time during the day when we're most sleepy, which for most people occurs during the night time from about 10:30 through till 7:30 in the morning. Some people can be later and some people earlier. That are the owl types, have a late onset of sleep and late to get up, and the lark types, that are the morning birds that get up early and go to bed early. So sleep restriction is a textbook treatment for sleep problems of insomnia. And in its strictest form, we ask people to go to bed at 12 o'clock and get up at 6 o'clock in the morning. The idea being that we compress their sleep into a 6-hour period, and that makes it more efficient. It stops them from having so many wake-ups, and also because if they haven't slept for the previous 24 hours and they go to bed at 12, they should be in a good state to fall asleep. So in my clinical practice, I've found that strict sleep restriction works really well, but people have to be highly motivated to go to bed at 12 and get up at 6 all the time for a while. And what I tend to do is usually talk to the person and ask them, what is a good night's sleep for you? Because some people would say 6 hours is good for me. Other people would say I need 9. But most of us are somewhere around 7 to 8 hours of sleep per night. So we should schedule a time when we go to bed and schedule a time when we get up. In the strictest form, where we restrict people to 6 hours of sleep, once their sleep starts to improve, we can gradually roll back the bedtime and give them a bit more time in bed. So sleep restriction is a very helpful and good treatment for insomnia. And what happens with most people is they go, oh, look, I've been told to do that and I did it for a while, it didn't work. You need to do it for a good 5 to 6 weeks to get an effect. You can't just do it for one night and expect it to cure all your sleep problems. Because after all, many people have had a sleep issue for many years and it took a long time to develop. So I'm going to move on to the second key point. Slides. There they are. They're moving. This treatment is called stimulus control, and it's a very common treatment as well. And what we do here is we ask people if they go to bed at the same time every day of the week, and and they get up at the same time every morning, as for sleep restriction, that the only time they're allowed to sleep is when they go to bed. They can't be napping on the couch or lying elsewhere and sleeping. And the key thing here is that if you go to bed and you're not asleep within, say, 10 to 15 minutes, or even up to half an hour might be okay, rather than lie there and get increasingly frustrated, sometimes it helps to get up and go to another room for a short period of time until you feel like you want to go back to bed again. So that can be quite helpful. So stimulus control is limiting the amount of time that you're in bed and not sleeping, because people get very frustrated if they're lying in bed and not sleeping. So the trick would be to, with this particular technique, is not to stay up too much. If you're not sleeping, it's also important to get rest. So resting in bed is very important as well. So we'd only use this in a limited manner. Like if it happened on a hot night, I couldn't get to sleep, I might get up a few times, have a drink of water, then return to bed. But I wouldn't stay up all night waiting to feel sleepy, because it may never come. It's often better to compromise and go, well, I'm not sleeping, but at least I can get 6 or 7 hours rest in my bed, which is almost as good as sleep. I'm going to move on to the next slide.
Gerard, can
Okay,
you just speak up a little bit more? Just a little
sure.
bit more? Can you speak? Yeah,
Yep.
thanks.
There's a whole suite of things called sleep hygiene, and what these sleep hygiene ideas are is all the things that surround sleep. Say, for example, in order to fall asleep, I need to be in a low state of mental arousal and a low state of physical arousal. So my pre-bedtime behavior is important. Every night, you probably should spend some time trying to wind down and relax before bedtime, both mentally and physically. So that usually means doing passive activities like watching TV, reading, talking to family members, that sort of thing. I'd be avoiding doing exercise very late at night time, or doing a lot of computer work late at night time, because you turn your computer off, but your mind doesn't turn off for quite a while. Other things that we might address would be, some people like drink a lot of coffee or tea or Coca-Cola, things that contain caffeine. Some people think they can drink themselves to sleep with alcohol. It does work, you fall asleep, but unfortunately you wake up an hour and a half later and it can be very hard to fall back to sleep. I've addressed already, like too late exercise is not good. Eating too late at night time is not too good either, because your digestive system can disturb your sleep. And also drinking too much at night time can be a problem too, because it may make you have to get up to go to the toilet several times during the night. So in the area of sleep hygiene, what we're trying to do is get people to um, decrease their psychological arousal and their physiological arousal in the hours before bedtime by having a wind down period. So after dinner, do relaxing passive activities, and then you have a routine where you go to bed. So most people's routine is fairly simple. They brush their teeth and wash their hair and make sure the cat and dog are comfortable, and then they switch off the lights and go to bed. I'll move on to the next tip. Okay, at the end of this session, Lynn's going to do a 4-minute mindfulness technique to help people relax, but relaxation training can be also very good to learn as a way to help yourself to fall asleep. And one of the most common techniques is slowing your breathing down. Another technique that's very good, because it mimics what happens when we do go to sleep, is progressive muscular relaxation. In a progressive muscular relaxation script, the person saying the script would ask you to slow your breathing down and relax different parts of your body gradually in a progressive manner. So if you watch someone falling asleep, this is what happens. Their breathing slows down, their muscles relax, and suddenly they fall asleep. So progressive muscular relaxation could be a good precursive relaxation to practice in bed for promoting sleep if you have difficulties with sleep. There are other techniques such as visual imagery and self-hypnosis that are similar to the muscular relaxation technique. Some people have difficulty relaxing, so they might benefit from biofeedback. This is where we might strap a heart rate monitor onto their finger, or one of these sports watches, and you can monitor your heart rate and see if you can slow it down by breathing and relaxing. So relaxation training can be very helpful for not only reducing time it takes you to fall asleep, but also reducing your anxiety you might have about sleep or about other things. So you might consider downloading mindfulness apps or relaxation apps on your telephone. Then you can play them when you're lying in bed if you're having difficulties to relax, to fall asleep. Moving on to the next slide. Okay, in a normal sleep consultation, we'd always ask people about their exercise and diet. So we like to encourage people to do regular exercise to promote weight maintenance and weight loss if that's a problem, and also look at the person's diet to make sure they're having a good balanced diet. Given that I'm a psychologist and not a dietitian, if the diet was too bad, I'd refer the person to a dietitian to get better advice about how to eat properly and what to eat for their particular body type, their particular issues they might have. So exercise is important because it tells the body that it's daytime, and if you don't do much exercise, your health suffers over the longer term. So one of our last prime ministers has stated that sitting is the new form of smoking, that we all sit in front of computers and do little, and it's just about as bad as doing behaviors such as smoking. So exercise is an important part. You don't have to go exercising wildly or intensely. It's just doing moderate amounts of exercise a few times a week. Walking is good for most people because it's cheap and it's free and it's enjoyable usually. So some people prefer gym exercise or more intensive, but it's up to the person and their age and their capacity. I'm going to move on to the next slide. It's always a good idea to have a look at medications when you're assessing someone's sleep problems, because when you look at the side effects of many medications that people might take for things like blood pressure and so on, there can be side effects, and there's also interactions if you're taking more than one medication. And one of the side effects of many medications is it can cause insomnia itself. So far I've only been talking about insomnia that might have been caused by psychological stress or poor behaviors like drinking too much coffee or not relaxing before bedtime. But some people's insomnia is caused by medical conditions such as pain, might come from arthritis or other aging conditions. So if that's the case, then that needs to be treated properly so that the pain doesn't cause problems at night time for people's sleep. So medications should be reviewed by your GP or a team of people that are specialists in that area that you're looking at. Moving to the next slide. Oops.
I think that's the last one, Gerard.
That's the last slide. So yeah. I'm happy to take questions about sleep, insomnia problems that people might have, and wonder if you're wondering about other sleep disorders as well, because another sleep disorder that's fairly common is sleep apnea, and other people have things like movement problems during their sleep.
Thanks, Gerard. That's been really helpful and very comprehensive. I was just seeing a question saying, has your institute undertaken any research on sleep sorry, it's just disappeared off the screen, where on enduring mental ill health, where the circadian rhythm is quite out of whack and difficult to regulate?
Yes, we do know a lot about circadian rhythms and their role that they play in controlling sleep. And the most common circadian rhythm disturbance of sleep is called delayed sleep phase insomnia, where the person can fall asleep, but only very, very early in the morning, like 3 or 4 or 5 o'clock in the morning, Then
Mm.
they can't get up at the socially desirable or socially required times to go to work or school or whatever, and
Yeah.
can create a problem for some people. In the research, there is some indication that some people have that pattern anyway. We call them an extreme owl. They're a very late to sleep person and a very late to rise person. And
Mm.
if that's the case, and they've always had that pattern since early childhood, the best advice for such a person would be to choose a job that suits that particular pattern. Don't join the public service where you've got to be there at 9 o'clock. Even with flexi time, you still won't be able to fit to the times. You might get into the business of being a chef or something like that, where you start work at 5 and finish about 1, and then go home and enjoy your time, and then go to bed at 3 or 4 in the morning. We can help people by using bright light therapy, light in the morning, also melatonin an hour or two before bedtime that can pull the sleep back, and the light in the morning pushes the sleep back. But once you stop the treatment, if you are the owl type, you'll probably spring back to your original pattern of late to bed and late to rise.
Mhm.
I hope that answers the question a little bit.
Yeah, yeah, no, that's interesting to sort of fit our lifestyle around our inherent sleeping pattern. But I suppose there would also be the mental illness aspect, so that's slightly different again.
Yep.
But,
It's very interesting because every major mental illness also brings with it a plethora of sleep problems. If you take post traumatic stress disorder, for example,
yeah.
people that have post traumatic stress disorder have nightmare disorder, they have insomnia, they have
Mm.
breathing problems during their sleep because they're not really relaxed, they have mild sleep apnea. They also have movement problems during their sleep. They also have uh, movement problems and acting out their dreams. So I've probably mentioned about 5 different sleep disorders that are incurred by someone with post-traumatic stress disorder. People with schizophrenia and psychosis type illnesses tend to have nightmares, delayed sleep phase problems, and insomnia often. So, and people with anxiety disorders tend to have insomnia because, in a way, insomnia is a sort of an anxiety problem itself. It's an anxiety about, am I going to sleep tonight or not? As soon as you say that, it often staves off sleep for another hour or so because you become tense and worried about your sleep. If to fall asleep, you're usually not thinking about sleep at all. You're thinking about other pleasant thoughts, which is another technique that can help you fall asleep. To think about
So,
pleasant memories.
sorry. Yeah, yeah, seeing a few questions here. I've just started a course of anti-inflammatories and am sleeping well through the night. It made me wonder if inflammation made my sleep unsettled because nothing else has changed.
That's a very good observation because I did mention before that often sleep problems, insomnia in particular, are secondary to medical conditions. So
Hmm.
if you've got an inflammatory condition such as arthritis, then it will disturb your sleep. When you lie in one spot for too long, it becomes painful and that your body wakes you up. So you might wake up several times a night, have to move around, and often as you wake, the more times you wake, the closer it gets to morning, then the harder it is to get back to sleep again. If you wake early, you often fall back to sleep because it is natural to wake up once or twice a night for a very short time, then you fall back to sleep very quickly.
Mm. So, and a question about how long wine time period should be. Is it 10 to 15? Is that enough to sort of say, that's my wine time, wine down time?
Um, I was going to say, is it wine time or wine down time? Yeah.
Yeah.
Um,
uh,
Wine time is about 5 o'clock in the evening.
yeah.
So wine down time, you need at least 1 hour or preferably 2 hours to wind down, not 15 minutes. So
Mm.
after dinner, if you're doing more passive type activities like watching TV or fiddling around a little bit on the computer, that's okay. But I wouldn't be doing, work on my computer because when I switch it off, I still keep thinking about it. I could be looking at, internet sites or something interesting, but something that's not going to enliven my mind too much. So watching TV is pretty passive, reading's passive,
Mm.
um, and chatting with family members or playing games can be quite passive as well. So just at least 1 hour, but preferably 2 hours to wind down the body mentally and physically wind down.
Mm, mm. And what about waking during to hot flushes? Is that insomnia, or is it just, sort of you're thirsty and you're hot and you're waking up being disturbed? So is there any sort of suggestions around that for many women
Well,
as an issue?
it can it can be a symptom of insomnia generally for men and women that their body temperature gets out of control because their sleep-wake cycle is at a wrong circadian phase. They're not sleeping well during the night time. Their body starts to be warm when it should be cool. Because when we go to sleep, our body temperature is on its descending limb, going down towards its lowest point at 3 a.m. in the morning.
Mm-hmm.
On top of that, when you look at sleep efficiency over the lifespan, what you notice is in women, when they get to about 40, there's a decrease in their sleep efficiency because of menopause, because they might have hot flushes and changes in body temperature at night time that causes wake ups and insomnia.
Mm-hmm.
Once you get woken up, sometimes it's hard to fall back to sleep, which is a maintenance insomnia rather than onset going to sleep insomnia. So body temperature is very important. Some people benefit from having a nice hot shower just before bedtime. Then the cooling effect after helps them to fall asleep, which is sort of helping to promote the gradual decline of body temperature to its low point at 3 a.m. in the morning.
Mm-hmm. And what would you say if someone was waking at night having to take really deep breaths? They're almost not breathing and this woke them up. Is that part of sleep apnea or something else?
Yeah, I would advise them to have their GP to refer them for a overnight diagnostic sleep study, because it could be a sign of obstructive sleep apnea, which is basically when we lie down, and particularly when we lie down on our back, palate and tongue can fall down inside your throat and narrow the airway, restricting the airflow, which is what obstructive sleep apnea is. It's actually a breathing disorder during sleep rather than a sleep disorder as such. So sometimes if it's mild, treatment could be trying not to sleep on your back. If it's more severe and the person is older and overweight, then they might require more intrusive treatment, which is the nasal CPAP pump, which is an air pump that helps keep the throat patent or inflated during the night time. But you need to go for a specialist assessment of your sleep to see what's happening if you're waking up with choking or spluttering feelings during the night time.
Mm. And Helen is saying impacts on rising early for work are difficult, and working from home was a great catch up for rest because not having to get up early to get to work. So how will will this continue post COVID to have a positive outcomes for those with sleep? Oh, sorry, I just can't quite see the.
I get the gist of the question.
Yeah, so working from home, how will working from home make it possible for positive outcomes for those with sleep issues?
Working from home does give you a little bit more leeway to have a bit more sleep in the morning. I can certainly say that for myself because, when I live in Harcourt, which is about an hour's drive from Ballarat. So when I want to be at Ballarat by 9 o'clock or earlier, I've got to get up a lot earlier. Whereas when I've been working at home, I don't have to get up quite as early. So it is a little bit beneficial to be working at home because you don't have to get out of bed as early to get to work because you don't have the travel time. And the same is true on the way back. You don't have the fatigue problem of having to travel back and drive and so forth. But after COVID and we have to go back to work, I don't think we'll be, some people may be able to continue to work more at home because I think some employers will realise that employees could work at home quite well in many cases, not maybe every day, but at least a few days a week, which would help with office space and all sorts of other issues, obviously.
Yeah, and a question about dreams that, I dream every night, tend to have many deep dreams of different calibers, but seem to wake exhausted. So that issue of dreams and our deep sleeping.
Okay, so it's normal to dream at least 5 or 6 times every night, and each period of dreams starts to be, the first one starts off as maybe 10 minutes, and as you go through the night, the periods get slightly longer. And often the last one can be very long, about 20 minutes. And all our dreams are usually in real time, so whatever's happening is in real time, like a movie. And sometimes if people have a lot of dreams, it can be exhausting. It can be also a response to um, psychological things that are going on in your life, that there's a lot of information to process, because we believe that dreaming is when we process what we've learned and seen and heard and smelt during the daytime. And so if you're doing lots of study and lots of new things, often you dream a lot during the nighttime. It can make you feel exhausted. But again, like if you're concerned about it to the degree where it's actually affecting your well-being, an overnight sleep study might be of interest to see if there's any excessive dreaming. The other thing that promotes this excessive dreaming is many antidepressants and sleep medications suppress dream sleep. So when you stop taking them, you have a rebound effect. You seem to dream and dream and dream every night for weeks until you have a sort of a catch-up period. The brain's having a catch-up period. So some people feel exhausted and they'll revert to using the same medication again to stop the process happening. So it's a tricky one, that one. Yep.
And just quickly, how many hours before sleep should you stop eating?
There's no set rule, but like the later that you eat, like if you had a large pizza at midnight, it's going to disturb your sleep if you're going to go to bed 10 minutes later. So sometimes small carbohydrate meal just before sleep can be helpful to promote sleepiness. So a piece of toast or something like that. But in general, it's better to eat about 6:37 if you're going to bed at 10:30, so you have a fairly good break between when you eat and when you go to sleep. One of the things that we see in clinical practice is that some people complain that they wake up at night time with a bad taste in their mouth. Often that's because they eat too late, then they have gastric reflux, and that wakes them up because it's your heartburn, basically, that sort of pain you get when you've overeaten and food starts to come up the wrong way, slightly with a little bit of acid with it. So if that happens, we ask them to go and see their GP to get advice about whether they've got a hiatus hernia or that type of problem and have reflux.
Okay.
Reflux can also be a sign of anxiety as well.
Yeah. And just one last question. I know Stephanie is saying that she suffered nicotine-induced insomnia, but as soon as she quit smoking, her insomnia disappeared, which was just great. And then Danielle, just the last question, is saying, in regards to body temperature, when going to sleep, would the use of heat packs, electric blankets, have a negative impact on falling asleep?
If it's really, really cold, no. But if you overheat it in bed, it's often hard to fall asleep. So you just want to make sure you don't overheat yourself.
Yeah.
At the moment it's pretty cold at night time in Ballarat and in Harcourt, so I tend to have a little heater, just taking the chill off the air helps me to remain in a good sleep. So don't overheat yourself.
Yeah, good, good. Well, thank you so much, Gerard, and I'm really pleased to say, yeah, no, great. And Gerard's kindly provided his sleep audio, and we also know that another sleep specialist that Gerard worked with at the Austin Hospital, Dr. David Morovich, is this Friday launching his sleep program online. So we're going to include both those resources in our next newsletter. And if there are people who aren't on our newsletter, please go to compassionateballarat.com.au and sign up. So we usually finish with a mindfulness practice, but I notice we've sort of gone over a little bit today. But I just wanted to do that by going through two of Gerard's sleep suggestions. So the first one was around when you're lying in bed getting ready to sleep, to make sure that you replace any negative thoughts about sleep with statements, that you use in your own words, but something like resting in bed is good, or I like to rest in bed. Because you're more likely to fall asleep if you're lying in bed in the dark with a calm mind. And I remember you saying, Gerard, that the mind doesn't take us into sleep, the body does. So we need to drop from the mind to the body and allow the body to take us into sleep. And the second is one you mentioned, which was again this sort of body relaxation process, which is just going through, starting from the feet and coming up and relaxing parts of the body in sets, so both feet, both knees, both thighs, and spending about 10 to 15 breaths in and out, relaxing each set of muscles. And that's the process that you go through on this audio tape that we will be sharing with you. So thanks again, Gerard. That's just wonderful. It's a big issue.
Pleasure to try and help people sleep. So thank you very much for inviting me, Lynn.
Yeah, no, great. And then next week is also a good session. So we're going to have Maria Marshall, who's a naturopath and a psychologist and a nutritionist, and she's speaking about nutrition and the immune system, which is a really important topic as we move into winter. So thank you. Thanks again, Gerard, and thanks everyone, and look forward to seeing you all again next week. All right. Thanks. Bye now. Bye.